And it has not been easy getting to this point with the long lines of cars at vaccination sites and a lot of frustration over simply trying to make an appointment. And leaders are now worried about a new issue. Data shows that only half of Arizonans even want the vaccine.
And that is a huge red flag to one lawmaker who says it needs to be addressed as soon as possible. Brianna Whitney's live tonight with a look at the issue and also what's being done to try to change some minds. Brianna.
Well, today, Senator Mark Kelly really laid it all on the table. He said at first our state had a vaccine distribution problem with throwing doses out. Now we have a supply problem without enough doses. But he says soon he expects there to be plenty of supply, but not enough people who want them.
While many are excited to get the COVID-19 vaccine, others have their apprehensions.
My hesitance was that it only came out a month ago. It's not even been on the market for less than a year.
Patty Fryover was one of those concerned and wasn't going to get it at all. U.S. Senator Mark Kelly is worried about how many more feel the same way. On Tuesday, the senator speaking at Luke Air Force Base and said, quote, "We have the doses, we have the distribution system, but with my conversations with the governor, he's got data that only 50 to 55% of Arizonans are willing to get vaccinated. We need that number to be at 75%.
My goal is to educate my patients as much as possible and then let them know that I've had myself immunized. I've asked my family to be immunized.
Dr. Andrew Carroll is not only a primary care doctor, he's been Patty's doctor for more than a decade.
There's a lot of primary care docs out there who have these very long-term relationships with patients. They've come to trust us through thick and thin. That's what changed her mind.
He's never led me wrong yet.
Other groups relying on trust as well. Neighborhood Outreach Access to Health, known as NOAA, serves much of the Phoenix area, medically caring for the underprivileged and working poor. They're now administering the vaccine to eligible patients, giving about 1,700 doses in 8 days.
We started with a list of NOAA patients who've been with us at least 3 years, knowing that the relationship was important. We're all in all together, which develops a lot of trust for the patients. When we say it's time for them to get a vaccine, to be part of the solution for the pandemic, they're all in.
Now, with more vaccines getting to family practices and doctors' offices, healthcare professionals hope that can get Arizona closer to that 75% needed for herd immunity.
I think I'm going to be okay. I'm going to get over that little fear that I had.
Maricopa County also tells me they're partnering with several organizations to reach different communities, and they also say they're working on a new advertising campaign that will focus around vaccine safety and efficacy. Jared, back to you.
It's good to see the work NOAA is doing, trying to help our underserved community. Brianna, did they mention any more specific tactics, these organizations that are using these tactics to try to help patients feel more comfortable?
Yeah, so trust is a big thing with NOAA. They actually have some bilingual doctors who speak Spanish so that when their patients come and they do speak Spanish or a different language, they can actually get the vaccine from a doctor who speaks their language. And they're also working on sending out text updates and getting information out constantly to their patients just to keep them up to date on everything as things change. So they're certainly doing a lot to build that trust with their clients.
It's all about that herd immunity. Brianna Whitney live tonight for us. Thanks, Brianna.